happened, if any show has
Mm.
occurred. And to the
Mm.
glory of God, it came out two lines, not one, two lines.
True, like, so you're welcome again to this YouTube channel. If you are seeing my face for the very first time, I'm Victory Nkuka. With this channel, I share a lot about immigration updates you need to know about life in the UK. On this very day, we have a special guest in the house, my dear friend, Mrs. Lovett Bello. So she's going to be sharing with us her experience delivering her wonderful twins in the UK. So this is to inspire you, and this is to give you an insight into how the UK delivery system works. For your information, she delivered the twins naturally. I'm really amazed. I know at the time when we relocated to UK, many of us started our families. 90% of us gave birth through cesarean session, and it became the thing that everybody was like, I think it's just cesarean session, but this is not just one. I delivered one through cesarean. She delivered two naturally. It's actually a story of grace. She'll be sharing a lot with us today on this live show. Please, if you're privileged to join, share the links to anybody you think it would benefit. Without wasting much time, I'll leave the floor for Mrs. Lovett to introduce herself to us, give us a big intro, and yeah, and then we crack on from there.
Okay, thank you, my Victory. I'm very excited to, be in this position where I tell my story, where I educate, support, and inspire others out there, especially for the ones who are waiting, the ones who are pregnant at this time, and waiting for their day of evidence. I pray that our expectations will not be cut short. My
Amen.
name is Lovett Bello, as my Victory has said, and I'm a registered nurse and a midwife here in the UK.
Mm-hmm.
Not a registered midwife in the UK, but a registered nurse from my home country. Yeah, and um, after school, I've been practicing, and to God be the glory, I'm still practicing in a different country just now. So
Yeah.
I gave birth in the UK to a twin.
Mm.
Yeah, twin boys, and it was actually through the vagina birth. So just sit back, listen to the story, ask your questions, and take a glass of juice, a glass of wine, or a glass of water, just to, calm your nerves and to enjoy the ride. And I hope Mama Victory is ready to give you more content and to make your minds more informed. So that's
Mm.
me. Love it. And I'm happy to be here. Thank you.
You are in for it, guys. If you've been able to join, please share this link to as many others so that they could join. Because with this information you'll be getting today, you learn much more. You have an insight. Perhaps it's just for curiosity's sake to know what it is like to be living in the UK. And she mentioned that she was a nurse and a midwife in Nigeria, similar regard. I remember when I was my pregnancy and delivery experience, I was trying to compare literally everything. The practice here and the practice of what they do back home. Somehow it's a different ballgame entirely at that last minute. They have their own principles. Sometimes they say it's scientifically proven and everything. You are going to learn a lot, I tell you. You are definitely going to learn a lot. So to allow us to do justice to it, we are going to group this in different steps. If you are here to like this video, share the link. Like this video, share the link, send your loves and your congratulations to Mrs. Lovett Bello. Congratulations on your twins again. So
Thank you.
I will allow her talk a little bit more about her pregnancy experience. Mrs. Lovett Bello came on a work visa and she was pregnant with twins, working in a private healthcare like myself. So, was there any support or anything? Was there any support they gave to you during pregnancy? Were you still doing lifting and everything? Like, how was it? Were you able to manage cope with your twin pregnancy alongside your work?
Okay. Thank you very much, Ma. First off, I would like to say that being pregnant in the UK, it has to do so much with open-mindedness. So,
Mm-hmm.
like as Mama has said before now, she said the practice in our home country and the practice here is completely different. Completely different. So, if you're not open minded, you won't really have so much. You won't really, benefit so much from the whole process. So, one of the key factor is for you to be open minded. So, I'll just briefly talk about my experience. First off, I was pregnant and I didn't know I was pregnant. I was
Wow.
just, yeah, I didn't know I was pregnant. So I was just, living the life and all of that. I was seeing my period normally, enjoying myself, and then bam, I missed the period and I was like, let me go on to check if anything has happened, if any show has
Mm.
occurred. And to the
Mm.
glory of God, it came out two lines, not one, two lines.
True, like,
Yeah, it came out two lines. And I was like, wow. So how come I didn't miss my period all the while? So probably I'll be in my early stages. But little did
mm,
I know that I was actually wrong. So I've been pregnant all along, but I didn't know I was. If not for the
wow.
time I missed the period, I wouldn't have had any clue that I was pregnant. So one mistake I did, I told you before now that I'm a midwife, and first appointment in Nigeria is usually around the period of 12 weeks. That's 3 months for your first appointment with your doctor in Nigeria. So I was just waiting. I said, since I saw that the blue line just showed on my strip, then maybe probably I'll be 1 month or maybe 6 weeks gone. Well, I was wrong. So I waited, calculated in my mind the normal
Um,
12 weeks that I
wow.
would if I was in Nigeria. So and then I called my GP to tell my GP that I missed my period, that I think I'm pregnant, and I was scheduled for my midwife appointment and my scan appointment. Okay, so if you're having your baby in the UK for the first time, the first thing you need to do as a mom is for you to inform your GP. It's not really a serious something like that. Just go online and type GP close to me. You'll see their numbers. So you just call the receptionist to pick and she will ask you what you want. So you can just explain to them that you missed your period and you want to get in contact with the GP. So the GP, you won't do anything from there. The GP
Yeah.
will take off from there and book you with your midwife, and also give you a number to phone so you can call, and then they'll book you for your scan appointment. So it's just as easy. It's not really a big deal. So the midwife will be contacted by your GP, who will call you, and then your scan appointment will be done possibly by the doctors in a hospital after the GP must have given you their number to phone. So it's really not so difficult. So for me, when I was booked with my midwife, I was thinking in my head that I was 12 weeks gone, according to my calculation. And so when I got to my midwife, she was like, "Oh, you're welcome. How are you?" And all of that. I was like, "I'm fine." No, she was so happy seeing a black lady coming to
That's good.
the antenatal appointment. Yeah, they are so really excited when they get to see blacks. Believe me, they are really
Wow.
excited.
Wow.
And
That's
also
good.
getting to know that I'm a nurse and a midwife was so much, like, it was so exciting for her, because we started talking about so many things, and we just dealt from the appointment I came for with gisting and all of that. So what the midwife would do for you, if you're visiting her for the first time, she will do registration for you, which will be that she will take your details, she'll do an history for you, checking your past history, present history, your medical history, your family history, and all of that. And then she'll take bloods from you. So the
Okay.
bloods is majorly for full blood count, to check for blood grouping, your resource factor, so that in case at the point of your delivery in the future of that pregnancy, if you'll be needing a transfusion, she'll check, she'll also take bloods for, screening for illnesses like syphilis, HIV, and other kind of infections, taking your urine as well. So after she had done that with me, she gave me books for me to be informed. So I'll have to read them, get informed on my process of delivery, the pregnancy, and everything that has to do with it. Yeah.
Yeah.
So she will also give you a birth file. It's a blue folder. I
Yeah.
don't know about in England how it's
In
done. Yeah.
England, it's pinkish and it has, yeah, white, pinkish, and blue. It's just a mix.
Uh,
Oh, I love that
okay.
part.
Okay. So in Scotland, it's a blue
Yeah.
folder, and in it contains your documents. It contains empty files and empty documents. So as the time goes on, she does any kind of test for you, she'll get the results, and then she'll put them inside your file, and that file is for you to take home, not to leave in the hospital. So your blue file, or rather your pink and white file, according to England, I'm in
Yeah.
Scotland,
So
so the
that
blue file will be in your bag to follow you home, follow you everywhere you're going. Yeah. So it's every time you come for appointment, you come with the blue folder. So basically that's it. So at the first point of your meeting your midwife, she will give you a dental certificate, meaning that as a pregnant woman in the UK, you are entitled to 1 year before delivery and 1 year after delivery free dental care. So you
yeah,
have to submit that certificate to any dental practice so they can register you and you can get your dental care for free.
that's
Yeah, she'll give you,
amazing.
yeah. So she'll give you that on your first appointment. Then she will also give you medication. She will give you the folic acid, and she'll make sure that she gives you a ferrous sulfate. Ferrous, usually they build your iron levels so you won't get to have anemia during pregnancy. So they'll
Wow. Did
help
your
you.
midwife give you ferrous? They gave
Yes,
you.
she did.
Wow,
Yes.
that's amazing. Mine just wrote the prescription. I went to buy it myself. They didn't give me.
Oh, I think that's the difference between England and Scotland. There is
Mhm.
free prescription and free medication. Yeah.
Yeah. Wow.
Don't worry, you come
Oh,
to Scotland soon.
very soon to be serious. Okay, like I think yeah, our experiences were quite similar with the midwife. But although I didn't pay for those medications, just that she didn't give it to me directly. She just give a prescription or ask the GP to issue them. Then I'll go and pick it up in the pharmacy. So that's what they literally did. I think not for all of them, Sha. Not for all of them. Some of them I had to still pay for it. Vitamin D. I bought that one over the counter. She just told me to buy it over the counter and I bought
Okay.
vitamin D over the counter because of the weather. Well, thank you for that insight. And I think
Okay.
for those who are following or who may be rewatching this video, also in England, like what she has explained, you have this opportunity of having a one-to-one midwife who keeps following up on your case. Unlike back home that you come to clinic, you meet any random person, most especially when you choose that option of community, you are very they are very, very committed to your case, just one to one. Except you need multidisciplinary professionals, they will definitely refer you to hospitals for scan for those. But all they can do for you, they will definitely do all within their scope of practice. They will do it for you, which was a brilliant one. The only thing I missed was that another setting back home that everybody gathers and everybody's clapping and singing. I didn't get to
Yeah.
meet other mothers with big stomach coming together. It could be very fun meeting other mothers, although they booked me for one session, but the way it was not just the one that you just walk in, you have to book ahead. So when they sent me the email, I didn't reply saying I was coming. So when I went there, the door was closed. Let me didn't let me in. So apparently they said I would have confirmed that I was meant to be attending. I don't know if it's just my area, or it's general? But yeah. So thank you so much, Mrs. Bello, for that insight. Now, talking about the whole pregnancy experience, now out work, was it a bit, yeah, did they do risk assessment for you as well in your area? Was there support to just, yeah, make things easy?
Okay. So from my workplace, one of the things you have to do as an immigrant that's pregnant in the UK, especially, is that when you're pregnant, you need to inform your employer so they can be aware. The reason why you
Okay.
have to do that is so that they can make a risk assessment for you and they can plan your maternity leave. So they need to know on time. According to policy of some organizations, they'll tell you you need to inform your employers 15 weeks before your due date. 15 weeks before you put to bed. That meaning maybe you are putting to bed maybe in June. 15 weeks before June should be like 3 months. So that should be like March. That's
Yeah.
6 months. Your pregnancy should have already been big, of course. Yeah, so that's the time that some organizations would want you to tell them. um but then if your pregnancy is one that is having that is an high risk, there's every need for you to inform them even before that time so they can be aware and they cannot afford to give you a workload that is too much for you, or a work that will make you bend your back or strain your muscles too much, and you tend to have one complications or two from the pregnancy. So that's the reason why you need to inform them, and
Mm.
also for them to plan how you can go for your maternity leave and put other people in place so they can fill up your space while you are away. So for me, my work people, they gave me the support. For me, from Nigeria, where I am from, I did not inform them that I was pregnant. I just wanted them to see that I'm pregnant because, oh, love it. How are you? You're pregnant. Oh my God. How many weeks are you? Are you having a
Ah,
boy or a girl? Are you doing
ah,
a photo shoot? All those things are not something expected from where we are from.
oh, do you
So
have a name for the baby? They just ask you
exactly.
everything.
Do you have a name? Oh, okay, tell me what's the name of the baby? Stuff like that. I didn't want such kind of should I call it such kind of attention on me at the time. So
Mm.
I really didn't tell them. And to the glory of God, my bump wasn't so big. It was just me. If you look at me from behind, you won't even know I'm pregnant. But if you
Well
look
done.
at me from the front, you only know that I was pregnant when I was approaching the third trimester. I think about 8th to the 9th month. That was when it became very obvious that I was pregnant. Mind you, I
Wow.
was carrying two babies, but it was not so obvious. So
Oh,
at my fifth, 6th month, they started asking me, Love it, we are seeing that your tummy is getting too big. Why are you eating so much these days? You're so slim, you're so this, but now you're seeing that your tummy is getting too big. Please reduce the food you are eating. I'll just
oh,
look at them. Do you think so? Okay.
you
I'll continue my work. Do you think so? Okay.
you were
Okay. So me,
confident
I was
over
just doing
here.
my thing normal, normal. So it became so obvious at the third trimester. And they were like, oh, Love, you didn't tell us. You didn't make us aware. We would have stopped giving you all the work we were giving to you. We would have done this,
Mm.
we would have done that. I said, okay, thank God now that people are now aware. People should make me even stop working so that I'll come to work and not be working. So stuff like that. So they really supported me. They gave me all the emotional, psychological, mental, and physical support that I needed at the time. And
Yeah.
even at the time I was stopping I was going for my maternity leave. They organized the baby shower for me. They gave baby
Mhm.
gifts. They gave
Wow.
baby money and all of that. And mind you, they still did not know that I was carrying a twin. They didn't
Wow.
know. I went for my risk assessment, and I told my manager that I don't want I'm telling her now that I'm having twin, and I don't want it to be to the hearing of other persons. I just want to keep it to myself. And she was like, really? Oh, I wish I'm having a twin as well. Oh. And I was like, yes, so you wish you're
That's
having a
what
twin. Please keep
everybody.
it to yourself. Oh, everybody wants to have a twin. Keep it to yourself, oh manager.
Yeah.
So
Wow.
she actually did. And so I, to the glory of God, they really gave me that support. It was even at that time they treated me like an egg. They
Mm-hmm.
treated me like, this one, she's pregnant. Oh no, don't let anybody touch her. Oh. If I come
Yeah.
to work like this and
Yeah.
someone is sitting down and we're doing maybe a handover for work or something, they'll be like, oh, love it, I have to stand up for you, I have to get up, so you need to sit down, the baby needs to be okay, those kind of
Yeah.
stuff and all of that. I was
Yeah.
really pampered, and I wish I could be pregnant every other month.
Frankly, I said the same
I
thing. Like when I
wish.
returned from mat leave and the time that I wasn't getting that same pregnancy treatment, I was like, oh God, I wish I could.
Yeah.
Seriously, I love the fact that UK laws protect pregnant women. Even the risk assessment they do, and they know this law. So even when some of them are not so kind, and but they have to respect the law that you have to protect that baby in the womb, and they respect children. You know the safeguarding things and vulnerable adult, because the pregnant woman is a vulnerable adult. So they have to really. I love that part, and also remember, yeah, you mentioning your own experience with it. But it's amazing that your bomb did not go so big onto the
No,
third
it
trimester.
wasn't.
Despite carrying twins. And tons of for you to be able to keep that secret, because here is a culture shock. Immediately you take it and everybody knows, oh, what is she having? What's she having? Then you not be the one telling them I don't know yet. And when you not know, what will you name him? What will you name her? You say, oh my God. They will ask you all sorts, unlike where we are coming from, that nobody it doesn't. Well, it's a culture shock, but I think it's a good thing. They are open, and it's just that little way of expressing their love for you. If you're watching this video, please give this video a like, share the links to as many new things may benefit. We are talking about starting a family, what you need to know about pregnancy delivery in the UK. Love it. If this is just a tip of the iceberg, she's going to give us more of the gist. Hmm. How was the labor? How was the delivery? Was it painful?
Okay, we'll dive into that now.
Okay.
Okay, so first of all, before you get into labor, you have to know that as a person, as an individual, your care is your responsibility. Meaning that everything that you have to do before you get into labor should be checked and ticked. Yeah, that needs to be checked and ticked on the box. So before the labor, your midwife will book you for vaccinations. Maybe if you've not done COVID-19 test before that time, she'll have to do it for you. If you've not done the whooping cough vaccination, she'll do it.
Yeah.
Then flu in the UK is season now. So between the time of October to about the time of March, they will have to give you this vaccine. So you have to be complete on your vaccinations for the mother. And
Yeah.
then you have to be intentional about your vitamins, the folic
Mhm.
acid, the fesolate, any medication you are on at the time that you were pregnant, you have to be up and doing. You have to, be good with taking them. And then your nutrition, take enough of water, minerals, your proteins, your fat and oil. Make sure that they are all complete. Your balanced diet is key at this time. And then preparing yourself for labor, you have to be psychologically ready. You have to, speak with people who have gone ahead of you on the journey so they
Mhm.
can give you the encouragement. You need to pack your baby bag for the hospital. Yeah, so your baby box. I forgot to mention that Scotland gives baby box to every pregnant mother.
Wow.
Yeah.
What am I doing in England then?
You need to move to Scotland.
Wow.
Yeah, so they'll give you a free baby box, and on the baby box it contains baby clothes from the time of birth to about 6 months of age.
Seriously,
Yes, there's a thermometer, digital thermometer, bath
seriously.
thermometer. There is
Wow.
baby pacifier. There are books in it. There are.
Oh, love it. I'm coming to your house. I'm having my first
Please
baby in your
come.
house.
You are welcome. The door is
My
open.
God.
Yeah. So
Wow.
yeah, so from the baby box you can pick one or few things from it and you add to your bag for the
Now,
hospital
let
so
me ask
that
a funny question. When they knew you were expecting twins, did they give you two boxes or
yeah,
one?
they gave me two boxes. Yes. Everything was in double. I told you,
Hmm.
Grace was at work. Yeah.
Yes. Wow.
Yeah.
Wow.
Yeah.
Wow. This is the
Yeah.
story of grace indeed.
Yeah.
Hmm.
So you have to pack your baby bag for the hospital, and your baby bag should contain your baby clothes that the baby will wear at the time of birth, so maybe about some few days you'll be staying in the hospital, your pajamas for the mother, um your wig, very important, your camera, because you don't want to miss out on this moment. You need to take every shot of it. Yeah, so that when you are away from that system, you'll be looking back and like, oh my God, I was looking so beautiful while I was in labor. That's on a lighter note, yeah, but you need to look beautiful for the baby. You need to welcome the baby very well. Yeah, so you need to go with your wigs, your camera, your phone, your charger, your soap, your bits and essentials. You can also go for the baby as well, depending on the time you have to deliver. Like for me, I delivered on a Friday and I got discharged on a Monday. So I was told that doctors don't really make discharge over the weekend, like the Saturday and the Sunday. So I had to wait for Monday. And at that time, um, after the baby was born, there was still blood on the baby's head. So I wasn't used to that kind of system because in Nigeria, where I'm coming from, they will actually clean up the baby and the next day they'll bake the baby in the hospital, you
Yeah.
get. But I wasn't, it was a culture shock for me because this was not what was in place. They don't beat babies in the hospital. So um I couldn't just stay with the baby having blood on the head from that Friday till on Monday that I'll be discharged. So I asked for a bowl from the nurses, and I was given the bowl, and then I used my towel and my soap to clean up the baby and make sure that the baby was looking so good. And in that process, I tried to, do some molding and all of that. That's on the lighter note. Yeah. So now you're ready psychologically, nutritionally, mentally, your files, that blue file they gave to you, yeah,
Yeah.
you're ready, it's in your bag, and then you go for your appointment. Um, so I don't know how it's done in England, but here in Scotland, they will actually encourage you to go vaginally. Yeah, they won't just put up the um opportunity for you to deliver via a C-section. They will always want you to, go vaginally. It's except in cases where you have maybe you are at risk, your pregnancy is at risk, and you need the C-section, or maybe you have maybe an underlying illness that will not make you deliver vaginally. That's when the option of the C-section comes in. But in my case, because I was having multiple pregnancy, and um, I was having two babies at the time, so I was given the option to choose. So I was told if I want to go vaginally, I can, and if I want to go C-sectionally, I can. So I just have to choose the one I wanted. So I had to discuss with my husband to know the one that we would like to go for, and we opted for the vagina. We wanted to see how it will go, and we were just open minded to say, okay, fine. we'll get this done vaginally, and to the glory of God, it came out positive, and I'm having my evidence right now. So
Okay.
yeah, so they'll always encourage you to go vaginally, except in cases where you cannot. Okay, so got to my I got to the hospital. I was 38 weeks and 2 days when
Okay.
I delivered the babies. So when I got to the hospital, I was placed on induction because I wasn't in labor at the time, and they didn't want me to get to my due date because it will it will be at risk for the babies coming out at my due date. So they had to they had to plan for me to deliver before the time, so the babies will not be at risk. So I was given the date of the 38 and 2 days. That was the time I was planned for. So I was on induction,
Yeah.
was using the rolling ball to to play
Okay.
around,
I
and
did
then I
that as
was
well.
given I was given the the catheter ball. They'll put a catheter through your vagina and
Wow.
inflate with I think sterile water. And then when your cervix is open, it will fall off itself. Yeah. But then I stayed on that, and it was like it was burning. There was fire in the mountain.
Oh dear.
Yeah, it was so very painful. So finally the next day it fell off itself. So I was to go to the labor room. Um so finally I went to the labor room, and this is me and your midwife. So when you are in labor, you are assigned to one specific midwife who will monitor your progress from the beginning of your labor to the end, meaning she will be with you from the beginning of the shift till the end of her shift until you
Yeah.
deliver. Except maybe your labor progressed to the next day, then there will be a different midwife. So you have a specific midwife, and this midwife is different from the midwife you registered with in the hospital. Yeah. This one is the one that works in the hospital. The one you registered with, that the GP connected you with, that one was in the community.
Community.
She'll be the one to do your vaccinations, your blood tests, give you your blue file. But
Yeah.
this particular one, now you are in the hospital for delivery. It's a different midwife that works in the hospital that takes delivery.
Yeah,
Yeah.
I think yeah, in England, if you choose to give birth in the community, the same midwife will take it. But like for me, they gave me the option. I like to do home birth, like to
Okay.
give birth at home, to do pool birth. If I had done those ones, it would have been my same midwife. But because I
Mm.
chose hospital, so it had to switch to those ones.
Okay.
That's how they do it in this other side.
Okay, so just like as Mama said, so you're assigned to one midwife, and I don't know if it's in all cases you're assigned to one registered midwife and a student midwife.
Yeah,
Mama,
in
I don't
some
know if
cases.
it's like that in your case as well.
Yeah, in some cases it was like that, really.
Okay. So you're assigned to a registered midwife and a student midwife. So the student midwife, she's the one that will put those sensors on your abdomen to do the monitoring, and the registered midwife is the one directing her to say, go like this, don't go like this, do it like this, don't do it like. So it's like the student is learning from the registered midwife, and all of them are just having a good time in the room. You are in a private room. So that was the case for me, and I progressed in my latent phase. um and so I got to a point and I wasn't progressing, and the pain was too much. So
Hmm.
I already had the mindset before, because way back in the community, the midwife will actually do a structured antenatal teaching for you. I think Mama Vitri touched on that. So, like in some cases, it will be like a group at antenatal class where the husband will come with the wife. The midwife will be the one to be in the middle to teach the pregnant mother and the the
Husband.
father. Why am I calling her the pregnant mother? The pregnant woman or the expecting mother.
Yeah.
Yeah. So she will be the one, the midwife will be the one to be in the middle, and the expectant mother and the partner will come, and different for different people, and it
Yeah.
will it will be that she's teaching. So one of our classes majored on pain relief during labor, and I think there are about four of them, if I'm not mistaken. The first one is diversional therapy, where you have to do relaxation and deep breathing exercise, like you hold your breath and then you release, you hold. Imagine for labor you want to be doing deep breathing exercise. How is that possible?
Wow.
So for some persons it's feasible, but for me, even my voice was louder than the relaxation therapy. Because I was screaming. It was too painful. Yeah, so
Mm.
the next pain medication in labor is Etonox, and it's a combination of nitrous oxide, nitrous and oxygen. So it's
Yeah.
like a face mask. They'll put the gas in the face mask, and then they'll give you to inhale, and then when you inhale and you get to a point, I think the nerve cells and the pain around the nerve endings, they just, they disappear. But then after you take it off, for me, this is my experience, when you take
Yeah.
it off, it's like the pain is back again, and you
Yeah.
can't continue putting the Etonox in your nose and
Mhm.
inhaling all the time. You get so, at a point I felt like I was intoxicated, because it was making me feel high, like I was in another realm, like i
Yeah.
was i was tipsy. And then when I take it off, I'll have a breath of fresh air and come back again. It will be like I was high. I was like, oh God, this thing is not working, it's not working. Yeah.
Mm.
So I progressed, and I think I was already at 4 5 centimeter. And I told the midwife, I don't want to use this again. I'm not feeling it. The pain is coming. It's even coming more intense. And she was like, okay, so the next option we have now is the injection. So the injection is morphine and opioids. Like
Yeah.
they'll give you morphine through maybe your buttocks or your upper arm. Yeah, but I didn't want to take injectables, because I knew from the antenatal classes that morphine has a way of making your baby not breathe well when they are born. I think that's one of the adverse effects.
You said
Yeah,
it.
so I didn't. I had already zeroed morphine out of my mind before I came to the hospital. So I told her I don't want morphine, and she said the last one is epidural. And I was like, okay, I'm ready for the epidural. And so that was it. The anesthetic came in, and I was given the epidural. So the epidural is actually a spinal injection. Though I think you tilt yourself forward, and then they
Yeah.
inject the medication in your spine, and then it blocks from, I think, your abdomen downwards, and you don't get to feel any pain. You can get to feel like a touch, but no pain at all. Yeah, no pain at all. So that was what was my saving grace. Yeah, so the epidural was good for me, and I progressed up till about 10 centimeter, and um we we went for the delivery. And so for the delivery, um one of the babies was head down, the first baby, and then the second baby was lying transversely. So I was told that if the first baby um comes out and they do um external version, like manipulation of one was lying like this,
Yeah.
and the second one was like this. So the one
Yeah.
lying like this was okay to come down, But the
Yeah.
one lying like this, I was told that after the first one, there will be enough room for them to turn the baby so the baby's head can face down. But if it doesn't happen in such case, then they'll have to do vacuum extraction,
Yeah.
meaning they'll have to use is it forceps? Yeah, forceps delivery. So I think the forceps, they'll put one or put one down. They'll have to, maneuver and then
Yeah.
support the baby to come down. So that was
Yeah.
exactly what they did. So the first baby came out and they were trying to, do external cephalic version for the second one. And after the baby successfully turned, it was still eye up. Yeah, so they had to use the forceps to go in and then tailor it down, and then I was able to push. And then
Mhm.
that's me and my testimony.
Wow.
I
Wow.
was so happy that at last, God at last exceeded expectations at last. Oh my God.
Yeah.
Yeah, so the both of them came out and I was like, thank you, Jesus. Thank
But seriously, this is a really an amazing story. This is a fantastic story. How they were able to do the delivery and everything. I've learned a lot from it. And let's say, for instance, you are quite inquisitive about the UK delivery system. This has been quite insightful on how everything. It's a story of grace. Congratulations again, love it. When she was saying it, the first I remembered it was then I just remembered. I remember when they gave me that Etonos guide, my husband was just teasing me that I looked like a drunk because the way I was answering, like she said, right? Sometimes you even feel it makes you high because the idea is for it to numb your pain. So yeah, the Etonos guide did not work for me at some point as well. So I had to switch. I had to switch to epidural. We did the epidural at that time, and yeah, before we just carried on with every other thing. All right, thank you guys. We've come to the end of this. We'll send you the remaining parts on a on an edited video. So please watch out for that on the channel. Thank you so much.